Today, we're holding a public hearing on House Bill 106 related to nurse staffing in hospitals. I don't think anyone questions if we have a nurse staffing crisis, even if we aren't in agreement on the solutions. We know this crisis is not just a numbers question about hiring or retention. It's actually a daily question for nurses themselves. We hear that nurses are charged with healing, and in the current environment, they don't feel they can do so. When too few staff are in charge of too many patients, those nurses feel overburdened and overwhelmed. They worry about sick patients getting sicker on their watch. Then, unable to bear the strain, they are quitting. And that makes the problem even worse. Ultimately, this is a crisis for nurses, a crisis for hospitals, but also a crisis for patients. Our first panel includes policy experts. Dr. Linda Aiken from the University of Pennsylvania is one of the foremost experts on nurse staffing. So with that, let me have Dr. Aiken kick us off.
Thank you so much. Chairman Frankel, Chairwoman Rapp, and members of the House Health Committee, thank you very much for your attention to this important issue. I am Linda Aiken, Professor of Sociology and Nursing and founding Director of the Center for Health Outcomes and Policy Research at the University of Pennsylvania. The center's mission is to produce objective, scientific evidence to inform both policy and clinical practice in healthcare. The center has been studying the outcomes of nurse staffing in Pennsylvania hospitals for 25 years. We have no absence of information, and that makes us different from all the other states that are considering legislation like this, where they really know nothing about nurse staffing in their states or the relationship between variation in nurse staffing and outcomes. We studied the hospitals in Pennsylvania in 1999, in 2006, in 2016, and we're studying them again right now. So we have 25 years of data on them. We use clinical outcomes data from our own Pennsylvania PHC4, which is one of the best examples of state healthcare outcomes data. It's far better than data that you will hear reported, I think, by some of the testifiers today, including things like the Leapfrog and the Medicare rating system. So we are totally confident that we have long-term data, very good data. We collect primary data from tens of thousands of nurses on what their staffing ratios are, so we have better staffing ratios than any other source of information that you can get. This is NIH research. It's highly peer-reviewed. We have millions of dollars that we have invested in this topic over the past 25 years. The common findings from our 25 years, and I'll take the chairman's request and to summarize what I've written down in more detail. The common finding is that there's great variation across the hospitals in our state in patient-to-nurse ratios. And that variation is associated with serious adverse consequences for the public in our state and for the nurses that take care of those patients. In Pennsylvania, currently, the average patient-to-nurse ratio is 5.6 patients per nurse. But the variation, and this is the important factor in this legislation because it's attempting to set a floor under what the minimum requirement is. So the variation ranges from 3 patients per nurse, these would be adult medical surgical patients outside the ICU, to 11 patients per nurse. And by the way, the patients in the hospital where their nurse has 10 other patients didn't know that before they got there because there's no transparency in what the staffing ratios are to the public. So they're unable to take an informed step with regard to which hospital they should go to. And this is important because we know from not only our 25 years of research, but from hundreds of studies that have been done, both in this country and in other countries, that nurse staffing levels are one of the most important factors that determine whether patients live from their hospital admission, whether they're readmitted within 30 days when they go home, what their satisfaction is, whether they get an infection, and whether the hospital itself is penalized for certain things like readmissions or actually gets additional money for patient satisfaction. And the nurse-to-patient ratio is the single most important predictor of patient satisfaction in our hospitals. Been hundreds of studies on this. So what we have done is taken our research and estimated on the basis of really detailed information on most of the hospitals in the state, and that is hospitals that have more than 100 beds and have more than 100 admissions of medical and surgical types that we're studying, that if House Bill 106 is implemented, a conservative estimate of the number of lives that would be saved annually is 1,155 lives, a conservative estimate. And we had this same data 10 years ago. And if we had passed this bill 10 years ago, 1,100 people that live in Pennsylvania might still be alive today. In addition, if the bill were passed, we could expect 771 readmissions to be avoided. Medicare penalized 43% of all the hospitals in the U.S. for excess admissions, including a sizable proportion of hospitals in Pennsylvania. Importantly, in terms of what this might cost and the trade-offs between some hospitals having to hiring more nurses and some of the cost savings that they could achieve, the length of stay we estimate would be reduced by 40,000 days annually, which would save hospitals an estimated $93 million a day just from length of stay alone. And there would be many additional savings to hospitals to offset the cost of hiring more nurses, which would come from reducing nurse turnover, which now costs our hospitals millions of dollars, as well as savings from higher patient satisfaction, avoiding complications, and avoiding Medicare penalties. So that, in summary, the increased cost of hiring additional nurses would be substantially offset by the savings from improved patient outcomes, shorter length of stay, fewer Medicare penalties, and lower nurse turnover. Now, I want to address an issue that Chairwoman Rapp raised about the shortage of nurses, because this is an important contextual issue about whether there would be some adverse implications of passing a bill which I've suggested could save lives and improve health. And so would it be likely that House Bill 106, if implemented, would cause a nursing shortage in Pennsylvania? Well, the evidence really suggests that that's unlikely. I know everyone assumes that we have a nursing shortage. When I talk about a nursing shortage, I'm talking about the supply of nurses. We all agree that there are not enough nurses in hospitals. That's different from a shortage of the nurse supply. So the nation is adding 1 million new nurses every decade. And Pennsylvania has one of the highest RN to population ratios of any state. There are only 5 other states that have a higher, and DC, that have a higher ratio of nurses to population than we do. So we're well positioned with regard to the shortage. The state has 100 nursing schools. They're graduating about 9,000 nurses every year coming into the pool. Now, there's been some concern about recent studies that have suggested that in the near future, a lot of nurses are going to be leaving. And a recent study that's been cited by others is that 800,000 nurses nationally might leave the labor force in the next 4 years. But we have 185,000 new nurses joining the workforce nationally. So we have enough nurses to cover 800,000 nurses leaving in the next 4 years if they actually leave. And on that point, I would say, as a researcher, it's very hard to predict who's going to leave. And routinely, our estimates of the workforce have all been wrong, constantly been wrong. And most of these estimates come from nurses now that say they intend to leave their jobs But we've actually done the very detailed research that asks the question, how many people that say they're going to leave their jobs in a year actually leave their jobs? And it's a much, much, much smaller fraction of people that say they intend to leave their jobs. So all of these numbers of the huge number of people that are going to leave have been much exaggerated. Additionally, we have a lot of dislocations that caused by the COVID pandemic, as you know. Lots of nurses were actually furloughed and laid off during COVID. Many of them couldn't work because the schools weren't open and daycare. All that's beginning to resolve, and the evidence is that nurses are beginning to return. So our estimate is by the time this bill would ever take place, we would see much more of a representation of what we had before. But we'll make the point that what we had before COVID was not enough, because the majority of nurses before COVID said there weren't enough nurses in hospitals. And by the way, before COVID, we were beginning to have a glut of nurses in our state. And in some markets, nurses coming out of school couldn't get their first or second or third choice of jobs. And so even with that glut of nurses on the market before COVID, nurses in practice said we didn't have enough nurses. So our estimate, using all the evidence that we have and our 30 years in the field where most of these predictions have been wrong about both shortages and oversupply, that I think as a state, we're well prepared and we have the nurses to implement this without extenuating and important problems in access to care. Let me just make a few other very short comments. We appreciate that there's a crisis in care right now, but our research suggests this is not a crisis in nursing. This is a crisis in hospitals, and this is not just semantics. Nursing is stronger than it's ever been before. There are more Americans that want to be nurses. We've just passed an important milestone that for the first time ever in the history of the country, more than 70% of nurses have at least a bachelor's degree. The work of nurses is highly valued by the public. Nurses continue to be the most trusted profession as per the Gallup poll for the past 20 years. Indeed, we conducted a Harris poll last year, and we found that 90% of the public nationally support safe minimum nurse staffing requirements for hospital. All the evidence suggests that the current crisis in hospitals is caused by hospitals not being able to retain the nurses that they even recruit, with turnover being in the 25% range. And research shows that the hospital crisis can be resolved by appropriate and safe nurse staffing. It takes enough nurses in hospitals to keep the rest of the nurses. The single biggest reason why nurses leave hospitals is their workloads are way too high for them to be able to sustain over time and unsafe. I would like to point out that during the last hospital staffing crisis, the American Hospital Association published a report with the title, Within Our Hands, pointing out that if hospitals improved their adequate staffing and created working conditions that people wanted to be in and could sustain, that the shortage would largely be over. I'm a researcher, and my job is to bring objective scientific evidence to policymakers to inform them about choices. In summary, we have great data. It's been published in the best journals in the world. It's had serious peer review. Nurse staffing is important for patient outcomes. We do have the nurses and the wherewithal in our state to accommodate a proposal like in this bill 106. Thank you very much.